Elsewhere, Orient Bank is in serious financial troubles as 80% of their shareholders pulled out. The PHK Keystone Bank pulled out to concentrate on home investments in Nigeria. Orient Bank has now been taken back by its founders with only 20% of its shares left. The founders inherited a lot of financial problems, however, after making a huge loss last financial year with a huge percentage of loans not serviced.
Hands crossed, calm, composed. All seems to be well among managers of Orient Bank Limited. But no, they are back to the drawing board to sustain the performance and presence of the bank. Major shareholders from Nigeria owning 80% stake of the bank have pulled out. Julius Kaketo is the managing director, Orient Bank.
The founders formed the consortium and have taken over full ownership and control of Orient Bank.
After 5 years of financial relationship in Uganda that never matured, the Keystone Bank from Nigeria have already handed over control of Orient to the founders consortium after selling off all of its subsidiaries and focusing on its home market back in Nigeria.
Keystone decided to exit from the subsidiaries outside Nigeria. So an Orient Bank was one of them. And at the board level, we were at a discussion. And we felt that founders who still had 20% in the bank felt that, look, we owe a duty to our customer, to this public, because the bank was set up in 1993. And we felt that we should return back and see if we can take the ownership and control. But due to the restriction with Bank of Uganda, we could not go beyond 49%. So we had to find some valuable partnership who can really give a lot of input to this market and to the bank as well.
Orient Bank posted a huge loss last financial year, amounting to almost $70 million with increased non-performing loans. But managers of the bank believe they are turning tables and the bank will make profits.
We want disciplined growth. We want to make sure that we lend in a judicious manner, that we are very careful about managing the risks. So yes, there is a lot of potential in the market. The team here has a very strong pipeline to increase the deposits of the bank.
Pulling out by Nigerians from Orient Bank comes few months after Nigerian bank, Global Trust Bank, was repossessed by Bank of Uganda after failing to pull the required capital base for operation of a bank. Kenneth Bwire, WBS Business.
The number of cases of the typhoid fever registered in Kampala critically rose this week from 35 to 639, and fears remained of further increase after reports of new cases in Wakiso district raised suspicion of gaps in addressing the disease. The Ministry of Health last week confirmed an outbreak of typhoid in Kampala and called for vigilance.
This and more people are some of the patients that await health services at the Kisenyi Health Center in Kampala that has been designated to handle typhoid cases since the outbreak a week ago. The number has since risen from 35 to over 600. These are kept here under surveillance and getting treatment for the waterborne disease that the ministry warns may spread further. The latest typhoid outbreak in Kampala is attributed to the heavily contaminated water and other beverages being consumed by people. Assistant Commissioner in charge of Epidemiology and Epidemic Diseases at the Ministry of Health, Dr. Monica Musenero, attributes the surging outbreak to the contamination of the existing environment, especially water, sewer systems, and the laxity in household hygiene and sanitation.
Most of the water, apart from the packaged water, the mineral water, the rest of the water being consumed, the juices, they are all heavily contaminated with the feces. All the sources of water, in fact, we tested juices, we tested bushera, we have tested the water, this water which is packed in Govera, all of it is heavily contaminated.
The outbreak indicates after laboratory tests that there was increase in contamination of water, which led to 639 cases registered by Tuesday at Kisenyi Health Center 4, just a week after the outbreak was reported. Dr. Musenero, however, confirmed that the ministry is currently at the front line of the outbreak by managing the cases through the supply of drugs, providing technical support to Kampala Capital City Authority, and identifying the gaps like health personnel, as well as understanding the disease.
We have supplied all the drugs that are needed. The first batch and the second batch is being supplied today. We have also provided technical support. Actually, the individuals who are there out helping KCCA on a daily basis to make sure that everything at the health center is moving. We are identifying gaps because the numbers are more than we had initially expected.
Household health will make the difference in such a contaminated environment by keeping to proper hand washing 5 times in flowing water, excluding the mealtime and after the toilet washing, boiling of drinking water properly, leaving it for at least 2 minutes boiling, and households acquiring water disinfectant. Dr. Richard Wariomu, the Central Division Medical Officer, says the disease has become a threat because it depicted symptoms like fever, abdominal pain, vomiting and headache that are similar to malaria and could be misunderstood.
As we roll over during the weeks, we are realizing that we are seeing about 110 patients every day. As I talk now, the cumulative figure is about 500, with no death yet, except some 5 people who had died initially before we started treating.
Kasese district had the worst typhoid outbreak in the country in 2010-2011 that took 2 years to contain. When not treated in time, typhoid can lead to perforations in the intestines. East Africa is developing a new vaccine for typhoid that has already been tested in Kenya and Burundi and will now expand to Uganda.
Do stay with us now here on Week in Focus. We return shortly. Welcome back to Week in Focus. A section of legislators called on government to find ways to help victims of hemophilia, a hereditary disorder that sees patients bleed non-stop given it causes difficulty in blood clotting. Flanked by patients of the disease and medical personnel involved in the treatment, Sodo Health Minister Dr. Lulime Baiga insisted that the huge costs involved in the treatment of the disorder and the lack of machines to diagnose the disorder puts over 2,800 lives in the country at risk.
Most times the nation focuses on common diseases that affect a large population, but the strange, deadly diseases are swept under the carpet. A section of MPs and anti-hemophilia activists now rally the state to turn attention to this disorder that makes blood clotting impossible, causing continuous bleeding and costs a fortune to detect and treat. Apparently, government has only one facility in the country that has the capacity to diagnose it.
This disease is here with us, and we need to bring it to surface to ensure that a budget allocation is done and adequate attention is given.
The range, I can give the range, for example, those who normally fall between 250, the child between 1 and up to around 6 years. As I said, it is weight dependent. A dose of those ones can cost us 9 millions.
So we see a gap in reaching out to the very many people. And actually, this could be one of the ways we could reach out to these people to tell them that there are those people who, when they get injuries or cuts, may have their blood failing to clot.
The MPs now want the state to focus on equipping more health centers in the country to handle this disorder that most times has been mistaken for witchcraft among the locals. Here, victims share their painful experiences with lawmakers.
But to have a challenge, as they have said, of those factors, they are not available. And the challenge of the lab, because like in one family we might have tested one child, because of the test is very expensive, and we have about 3 or 2 more children that are supposed to be tested.
We are also now bringing to the attention of this country that because hemophilia exists and it is very expensive to treat, we may now need to do tests for those who have got bleeding tendencies, whether they have ever tested for hemophilia or not, to go for a test. Because you wouldn't like to have an abnormal gene to be passed over to the offspring.
Over 2,800 individuals are estimated to be suffering from the deadly disease. The situation now calls for state intervention to save the many lives of those suffering from the illnesses. Sabit Joseph, WBS Television, Parliament.
WBS TV journalist Andrew Lwanga took to the stands at Buganda Road Court this week, pinning the former Division Police Commander of Old Kampala Police Station, Joram Mwesigye, over assaulting him. Court at the same time rejected the application by the defense lawyer George Spencer, who wanted court to disallow other witnesses not listed before the trial started from testifying.
The principal witness in the case against the former Old Kampala DPC has finally testified, pinning the suspended DPC on the assault charges. Court presided over by the Buganda Road Court Grade 1 Magistrate Sanyu Mukasa heard how Andrew Lwanga was assigned to cover a press conference at Jema office, but as he was still executing his duties, he was battered by the DPC. He told court that he can no longer stand on his own without being supported, adding that he is incapacitated to meet his rent and other financial desires because he no longer works. Lwanga, who sustained injuries, told court that he was admitted at St. Francis Hospital in Zambia for about 16 days before he was discharged.
Yeah, I still have a lot of pain. What normally helps me to, be able to walk and move a bit, they tie something around my waist. This gives me, kind of support to support myself.
The Human Rights Network for Journalists applauded the expeditious trial, saying there's a likelihood of having justice, citing the denial of the application by the defense that sought to block new witnesses in the case.
The principal witness has been able to testify, and in his testimony implicated Joram Mwesigye. He told court how the attack on him unfolded and how he was on duty, well labeled with a company t-shirt. So we think that we're heading towards the right direction.
Prosecution led by Deborah Itao objected to the application on the basis that she had witnesses in court, Andrew Lwanga, and seeking for an adjournment was intended to delay the due process of court. Prosecution alleges that on the 12th of January 2015, while covering a demonstration by a group of unemployed youth who were heading to police headquarters in Nakuru to deliver a letter to the Inspector General of Police, General Kale Kaihura, to allow them hold rallies in the different parts of the city, Andrew Lwanga was assaulted by Joram Mwesigye, the former Division Police Commander of Old Kampala Police Station. Trial resumes on the 3rd of next month.